When a patient is told they need thyroid surgery, the fear often isn't just about the procedure itself. It's about the potential risks to the delicate structures surrounding the thyroid. Will I lose my voice? What will happen to my parathyroid glands? These are valid, critical questions. And to answer them, you need to speak with a specialist who is an expert, not just on the thyroid, but on the entire anatomy of the neck. Dr. Wolfe, welcome to the show.
Thank you so much. I've been looking forward to this.
Many patients, when they are first diagnosed with thyroid nodules, are referred to an ENT for these thyroid issues. And from your perspective, why is an otolaryngologist so deeply involved in thyroid care? What does your specialty bring to the table that is unique?
I think so. Otolaryngology is a surgical subspecialty that sort of the way I describe it is everything above the collarbones except brains, eyes, and spines. And the thyroid is definitely one of those things that we see a lot. We have to team up a lot with primary care providers as well as endocrinologists. And we provide several services with the thyroid. We obviously do thyroid surgery for those people who have indications. We reserve slightly a little bit, I would say, quasi-endocrinology, where we do work a little bit with the hormones and just sort of trying to make a plan for thyroid care.
Mm-hmm.
This is one of those sort of, it should be multi-specialty, sort of a multi-specialty care approach with different specialists sort of weighing in on what's the best for the patient.
Do you feel like that has kind of evolved over the last couple, I don't know, last decade or two? Because just in my personal experience, I found that my experience with ENT locally was that it was very low focus on the thyroid function and more on the surgical aspects. So do you feel like in the last decade or so that endocrinology coming into what you're doing, has that evolved more, or is that just a personal philosophy?
It's, I would say it wasn't forced on me, but I was working in a multi-specialty group that had an endocrinologist I worked very close with, and I got a lot of knowledge from him. And then he retired, and my multi-specialty group did not hire another endocrinologist. So the way my group worked was I was next to primary care docs in different clinics all the time, and they'd always ask me. And it sort of fell into my lap a little bit. I always had, I could easily do consultations with other endocrinologists. I am not an endocrinologist. The first thing I tell people.
Right.
But I do realize the impact that thyroid function has on people, plus, hyper and hypothyroidism, also euthyroidism, how important that is. I will often start the therapy on my patients after surgery, or I've even started therapy for people who are hyperthyroid and need to come down in order to get surgery from uncontrolled Graves' disease. Because listen, in today's day and age, especially post pandemic, we are very overworked, and to get into an endocrinologist can sometimes be 3 or 4 months. And if someone is hyperthyroid and tremulous and having palpitations, they need help now. And a lot of primary care docs are not comfortable with treating hyperparathyroid. I'm not, but I can start the process, make sure labs are going the way we want, and then pass that off to an endocrinologist. So I think that multidisciplinary approach is very important. So I think an endocrinologist has a role, a surgeon has a role, but there should be some overlap with helping that patient.
Totally agree. And I think that's so crucial that you point to that point that patients are suffering and they need help now. I've heard even 6 months to a year sometimes to get into an endocrinologist. I've been told by some endocrinologists it's kind of a dying field. Like no one is becoming endocrinologists now, and which is so sad because we need them. These patients, as you said, they're suffering now. They need help now. And so I think it's really great that you have kind of taken that on to start the process, get the ball rolling for them and get them some relief.